Welcome back to Fox 9 Good Day.
Well, creating a good skincare routine can look different from person to person.
For sure. Maybe you've got a teen at home or you're an adult struggling with the occasional pimple or ingrown hair. We are getting some advice from an expert.
Yeah, this morning we are joined by dermatologist Dr. Mohiba Tareen, and she's going to hone in on a real wide range of skincare topics. As we were chatting about this ahead of time, we all had different questions for you.
I'm ready.
Okay, so we're going to start though with something that maybe doesn't affect all of us, but has teens, especially when it comes to acne. The big causes, what are I know that the treatments have changed and become better over time. What do you suggest for people who have teens?
So it's interesting, 85% of teenagers will have acne at some point in their lifetime. So almost all of our teens will have it. We know it's due to hormones, right? As those hormones turn on, the sebaceous glands, those oil glands will get more active. We'll get blocked pores, we'll get infections, we'll get those bigger cysts. So there's much better treatments than when you and I were kids. When you and I were kids, we used to use very harsh things. The skin would be all red and raw. Now we have much better even over-the-counter treatments that I tell all my kids' friends to use them. So over-the-counter moisturizers, over-the-counter adapalene, salicylic acid, benzoyl peroxide. Those are some good things to incorporate into your kids' regimen. I always say it's nice to have a routine, right? So start in the morning, gentle cleanser, moisturizer with sunscreen. Okay. One thing I want all of us to take away as parents is 80% of our sun damage actually happens before the age of 18. So now is the time to have your kid start sunscreen.
You're right, because kids spend way more time outside than we do. I mean, just
yes,
they're out
for
there all the
sure.
time.
And you know, they're not reapplying, so at least if they're putting on sunscreen in the morning, they're getting some little barrier.
Sure.
Then at nighttime, again, gentle cleanser, moisturizer, and that's when you want to use your active. I brought a couple of my favorite actives.
Okay.
Adapalene is one that's over the counter. Adapalene 0.1 used to be a prescription. It was put over the counter several years ago. It's a prescription. It used to be a prescription, but it's a retinoid, and it helps increase cell turnover. So I really like that for my teen boys. It helps with all those blocked pores you see right there.
Sure.
So that's one of my favorites.
Okay.
This is such a topic of conversation, I feel like, especially in the world of preteens and kind of younger teens. There are so many products marketed to them that they don't need at this point.
Yes.
I know we could spend like 45 minutes on that. But kind of baseline, what should kids, what time, at what age should you start doing the cleanser, the moisturizer? When do you start that? At what kind of age?
Absolutely. So coming back to your first topic, we as dermatologists see so much worsening of acne with too many products and worsening of eczema, psoriasis, because all these kids are going on TikTok and Insta and they're seeing everything they should buy. And instead of cycling it, they use it all at one time, as you know, we like to do as interested people. But simply, I usually say around the age between 12 to 14, that's when kids should start their acne regimens. That's really when those hormones are turning on.
Okay. Quick question.
Go for it.
The pimple patches, not just for teens, let's just say.
I was going to ask that.
There's a lot of adults who have used them. Yay or nay?
Absolutely yes.
Oh, okay.
Oh, really?
For sure.
Oh, good.
There are some pimple patches that have actives in them that have benzoyl peroxide or salicylic acid. I like those because then you're actually putting something on your skin. If you're just using a pimple patch as a barrier, that's good too, because you're keeping your hands away. You're not spreading that staph bacteria or that that bacterial infection. And furthermore, I don't know if you guys know, but when you pick at a pimple, it often forces it deeper, and that's when people have scarring, versus just letting that pimple resolve on its own, and then it doesn't scar.
And if people watching haven't seen the pimple patches, they're cute. They're like little stars and little faces, like genius to kind of turn it into an accessory.
Yes.
As everyone's dealing
on the
with
same
that.
topic, like the little, like the nose strips and the face, is that kind of the same general trend topic? Is that actually useful?
So those are less useful, I'm sorry. Those are kind of more of a marketing ploy.
Okay.
They're just taking off a little bit of the dead skin layer, but they're not really doing anything long term. I mean, we're always tempted when the marketing, they show so much coming off.
100%.
But instead of that, we should be using something nightly like a retinoid or salicylic acid. That gives you more of an even peel rather than using that periodically, that then sometimes people get burns and things like that.
Yeah,
Okay, sure.
and obviously, eventually teens start shaving. Most men shave for the rest of their lives, especially their face. Obviously, women shave legs, but you get ingrown hairs. I have a huge problem with ingrown hairs, and I actually use a vitamin C serum that seems to work a little bit. Do you have any other suggestions on battling this? Because they can be really painful.
Absolutely. Ingrown hairs sometimes can get deep and become cystic, and you might need to have it extracted. So the time to treat it is before it becomes too deep. I really espouse kind of massaging the skin beforehand. You want to open up the hair follicles in a circular manner. It brings them up to the surface so that when you do shave, you're not forcing them deeply. Then you can, pat dry, let a little moisturizer, vitamin C. If you have a propensity towards infection, some over-the-counter antibiotics like clindamycin and things like that you can get are very effective, so you don't get the bacteria associated with it.
Okay.
I think what I'm learning too is no matter what you're dealing with, you could probably see a dermatologist and learn something about your skin to help you get through it, even at a younger age too with our teens.
Yes.
Can we go back to teens quick? Teen athletes. I know this is a season where hockey players are in their gear and wrestlers are on the mats, and you stay in this sweaty gear for a long time, like your whole body.
So long.
What's the best way to kind of deal with that added on top of your already surging hormones?
Absolutely. So I really, again, just like getting into a routine with your skin, you need to get into a routine with your gear.
Okay.
Hang it up dry. There's so much moisture. There's so much bacteria.
Are you asking teenage boys to hang their stuff up?
It's cute. I know. I have 2 football-playing sons, so I absolutely understand.
What is this? How long has that been there?
Months and months,
Yeah.
right? But yeah, if they can get into a routine, and if all of their friends are doing it, they're more likely to do it.
Sure.
Hang up their stuff. Change their gloves. Unfortunately, they might have to bring it home and have us moms wash it,
Yep.
or us dads, wash it. But they should get into the routine. Just like they cleanse their skin right after they get off the mat or the field, they should cleanse their gear. They should be wiping things down.
Is there a body wash that helps too if you're getting kind of like the back knee or whatever else?
Absolutely.
Okay.
Old school benzoyl peroxide, 5 to 10% wash. If you're more dry skin, you should use 5%. If you're more oily, you should use 10%. Use that in the shower, I say every other night, so you don't get too dry.
Sure.
That really helps. And bonus, it helps eliminate odor.
Oh, hey.
Yeah.
So,
okay.
That's a big bonus.
That is a big bonus. You mentioned dry skin. This time of year, it seems like all the moisture is disappearing. What should we be doing? It just goes away. I don't know what's going on. Give us some tips and some tricks on keeping that a little bit, as much as we can.
I mean, we all live in Minnesota, which is like a land of dryness,
Yeah.
no ambient humidity. Why did we choose this place, right? But a few things. When you shower in winter, you should use lukewarm water, not super hot water. Keep your shower short. As soon as you get out of the shower, pat your skin dry. Don't really scrub it dry.
Aww.
Pat your skin dry and put on your moisturizer. No,
Sorry, I'm just envisioning myself like,
I know. But it feels good.
Yeah,
it feels
it
good if
kinda
you
does,
leave a
yeah.
little water because then your moisturizer in better, and you should moisturize within 60 seconds. That's when your skin,
okay, really?
when the pores are open, all those little skin cells can accept the moisture better. So that's my biggest tip. The next thing is where we sleep. Hopefully we're getting 6 to 8 hours of sleep. Put a humidifier in there.
Okay.
That is you were saying anti-aging. That's my best anti-aging tip for you in addition to sunscreen, humidity. Me, as a middle-aged woman, we need moisture, and we might as well get it when we're sleeping.
Maximize those 6 to 8 hours, right?
Right.
Speaking of moisture, is every moisturizer considered the same? Like, are we going for lotions? Are we going for cream? Like, what is a moisturizer?
That's actually a great question. So in summer, I espouse lotions, though they have a higher water content. That's why they can be pumped. In winter, we should switch to jars.
like the
creams,
tub.
tubs.
Yeah.
Again, make sure your hands are clean when you're getting in there because you don't want to be spreading bacteria. But those are much more concentrated. You're getting more bang for your buck. And then if you're really dry skin, prone to eczema, psoriasis, you should be using things that are Vaseline based. So those really help form a barrier over the skin.
Wow, Dr. Tareen, thank you so
Oh,
much.
man.
Can you just hang out? We can just do kind of like house calls later after the show.
Do it.
I'm sure there's people at home too who are like, well, I have a question for her. I have a question. Thank you so much. We'll have to have you back.
Yeah. Thank
There's our endless topics.
You also have a table of products that we didn't get to show. I don't know if we can do like a little social media video
Yeah, we'll
after
do
and have
something.
you kind of call out some of your favorites.
I'd love to.
We'll
Okay,
give that to folks
good
who are
stuff.
wondering what they're seeing there on the table.
Thank you.
Thank you.
So we're keeping you around.